Hello everyone, today we are going to talk about hypotension. When the heart contracts, blood flows rapidly into the large blood vessels. The pressure generated by the blood on the vessel wall is at its maximum at this time, also called high pressure. The blood that has already flowed into the arteries continues to flow against the elasticity and tension of the vessel walls. The pressure on the vessel wall is called diastolic pressure, also called low pressure. During the blood circulation process, the pressure of the arterial wall is lower than the normal value, which is hypotension. Acute hypotension is a sudden and significant decrease in blood pressure from a normal level or a higher level, mainly manifested as syncope and shock. Chronic hypotension is divided into orthostatic hypotension and constitutional hypotension. The manifestation of orthostatic hypotension is a sudden change to upright feeding, low blood pressure, often accompanied by instability, dizziness, etc. Constitutional hypotension is more common in elderly women with thin constitution. The patient usually has dizziness, the feeling of a weak heartbeat. Often nothing can be found in the hospital. So how can I know what is causing my low blood pressure? First, the doctor will make an evaluation based on your medical history. If necessary, some auxiliary inspections are required. Blood tests to find out if you have anemia or spinal cord disorders. Understanding the heart's electrical activity through an electrocardiogram. Find out if there is vasovagal syncope by a Upright tilt test. Don't worry. Let me tell you a few of the more common situations. Strength hypotension is a sudden drop in blood pressure when you stand up. Gravity causes blood to collect in the legs. Intestinal accumulation in this era will increase the heart rate, ensuring blood supply to the brain. This gut-carrying mechanism doesn't work well in people with orthostatic hypotension. Therefore, it is difficult to ensure stable blood pressure. The symptoms of dizziness also appear. The principle of postprandial hypotension is similar to that of blood flow to the digestive tract after a large meal. The above increases heart rate if the enteral mechanism that constricts blood vessels fails. Hypotension. Blood collects in the legs, signals from nerves in the left ventricle to the brain, not low blood pressure. It's too high, so the brain sends commands to slow down the heart rate. The blood pressure goes down even further. Is there any way to prevent hypotension? Drink plenty of water to ensure sufficient blood volume. This is especially important on hot days. So when you change positions, you move more slowly. Give your body time to adjust. Don't eat too much at one meal. Drink less alcohol, because alcohol metabolism consumes water. Now, you finally understand what low blood pressure is all about.